Entering Sarah Bush Lincoln, Renee Fonner checks in with Peg Blair for arthroscopic surgery on her right knee. Renee continues the registration process with Vicki Butcher and receives her identifying armbands. After being shown to her room, Renee meets with anesthesiologist Cheryl Artman, MD, for pre-evaluation for anesthesia. Mary Gallivan, RN, reviews the consent forms with Renee and begins taking her vitals. Orthopedic surgeon Don Sandercock, DO, marks the correct knee for surgery, and Renee signs to verify it is the correct knee. Renee's hand is then cleaned, and an IV is placed. Mary discusses any allergies Renee might have, and a yellow allergy band is placed on her wrist. Rick Brockett, RN, double-checks Renee's identity and explains the surgery process. Rick is a nurse circulator and the patient advocate while the patient is unable to speak for themselves in the operating room. Mary starts Renee's medication, and Renee meets with CRNA Betty Butler. The surgery team then wheels Renee over to the surgery suite. Upon arriving in the OR, Renee is moved from her stretcher to the surgical bed. She is given extra oxygen before receiving anesthesia. Betty and Cheryl use a fiber optic laryngoscope for better visualization of vocal cords for intubation. Linda Coleman, RN First Assist, and Sydney Shackelford, RN Nurse Circulator, position Renee. A tourniquet is placed around Renee's thigh in case of bleeding. The knee is positioned in a brace to ensure Renee is secure. Betty finishes administering the antibiotic to reduce potential for infection. Rick then cleans Renee's knee with antiseptic skin prep. Kylie Hamilton, OR Tech, helps gown up Linda. Sydney tracks the vitals and times of the surgery on the whiteboard. The team starts draping the knee to prepare for surgery, covering areas that are not affected. Rick documents the surgery in EMR and pulls up radiology films on the large screen for better visualization. Renee is draped and prepared for surgery, with the sterile field placed above her. Dr. Sandercock prepares for surgery with his gown and gloves. He then makes the first incision in Renee's knee. A second incision is also made. The arthroscope containing a camera and light is inserted into the portal to view the inside of the knee on the larger screens. The entire inside of the knee is inspected. A meniscus tear is an injury to the cartilage that stabilizes and cushions the knee joint. Once the tear is identified with the arthroscope, the torn fragment is then cut free and removed through the other incision. The edge of the remaining meniscus is then shaved smooth. Any additional cartilage is also shaved. Dr. Sandercock then stitches up the incisions, as Kylie and Linda prepare the dressings. Dr. Sandercock injects local anesthetic to help control the pain. The dressings are applied and the knee is wrapped. Linda writes that the wrapping must stay applied for 3 days after the surgery. Renee is moved from the surgery table back to her stretcher, and she is then taken to a post-op bay for Phase 1 recovery with Wes Duncan, RN. Betty exchanges information with Wes regarding the surgery. Surgical Services Director Candy Donahue, RN, makes rounds to check on Renee. As Renee wakes up, Wes removes the tube from her throat, provides her with an ice pack, checks her vitals, and gives her more medicine. Renee is released from her bay when her pain level was well controlled, and she could fully comprehend where she was after coming out of anesthesia. Renee is then moved to Phase 2 recovery with Stephanie Chumley, RN. At this stage, Renee sits in an upright chair, is offered food, water, and Italian ice. She is switched from IV pain medication to oral pain medication. Stephanie checks Renee's vitals and explains the recovery process and instructions with Renee's mom. The IV is removed, and Renee is placed in a wheelchair to be released and taken to her vehicle. Renee then leaves Sarah Bush Lincoln and heads home to Hinesboro. She is scheduled to return for a checkup appointment with Dr. Sandercock the following week.